Yo, what's up, guys? Welcome back to my channel. So I get this question all the time, right? They're like, hey, can I work while going to school? And when I say school, I'm talking about like, professions I talk about in the past, like radiology tech, RN, I mean, even LPN, um, physical therapy assistant. I'm talking about those like 2-year careers, basically. And a lot of people ask, can I work? Can I make a living while going to school? So I'm gonna tell you something that I didn't know, when I was going to school. And, I didn't know, look, when I started school, I didn't know nothing about the medical field. I just knew that I had to get my life together. I had to start working like little dead end jobs. So I made a choice to go back to school, and I chose radiology. But if I would have known better, I feel like my school would have been, how can I explain it? Not the school would have been better, but I guess my experiences would have been a little better, because clinicals only do so much. When you go to clinicals as a student, whatever career you choose to pick, it's not the same as actually working there and seeing the everyday hustle and bustle of the medical profession. And that's keeping it real, man, because a lot of people are like, oh yeah, go to RN school, whatever, right? Yeah, you go to RN school, and then all of a sudden you never worked in a hospital before. You don't know what it is to actually work in a medical environment. So you go to school, you do your prereqs, you get accepted to the program, you do the little book stuff, and then all of a sudden they send you to the hospital, and you're like, what? We got to deal with this? What? This happens? So it's kind of like it's something that I wish I would have done before I started my medical career, or while I was in medical school. You know what I'm saying? Not medical school, radiology school. So these are the 5. Stay to the end, because I'm gonna give you 5 good choices to work if you're gonna be in a medical profession, because I believe that it'll help you a lot, right? So 1, I say CNA, right? And the reason I say CNA for nurses and even radiology, it don't matter. CNA is a needed profession. You're always gonna need CNAs no matter what. And it's funny, man, because some schools are different. You can get your CNA in as little as a weekend, like 2 weekends, no lie, or as long as 6 months. I don't know why they drag it out, to be honest. I don't. It's a tough position. It's a tough job, but it's needed. But to be honest, it's not that complicated to drag it out for 6 months. I'm just saying. That's just my opinion. I'm not a nurse. I was a CNA a long time ago, and I respect them tremendously. Now, the reason I say CNA is because, especially if you're going to be in a nursing environment, you want to go for RN, is that you're going to see how it is to actually be a nurse. And if you're really going to sit there and be like, you know what, am I going to sit there and go through school, all this, learning, struggling to become an RN or an LPN, and am I going to like it? Because in a way, just because you're an RN doesn't mean that you don't do CNA stuff. It depends where you work, how many patients you have, because patients can be demanding. The cool thing about CNAs is that you can work any shift. So you can work evening shift, morning shift, weekend shift. So if your school, as far as nursing or radiology tech, if your school's Monday through Friday, and you can be off weekends. Depends how much you want to grind. You know what I'm saying? Like, if you want to work every weekend, 12-hour shifts. There's even a 16-hour shift out there. Now, legally, I don't know if that's still legal, but back then when I was working weekends, not CNA, of course. When I was working weekends in radiology, my very first job, I used to work from 7 in the morning to midnight, then be on call from midnight to 7 in the morning the next day. I only had to work, I think I had to work Thursday night. I had to work Thursday night, Saturday and Sunday, those crazy shifts. I don't even know how you function like that. I don't know how I did it. Maybe I was younger, I was young, I was hungry, and I was fresh out of school, so I was like, yeah, I'll do that shift. But that shift is sometimes available for any career choice. So CNA is a good one, like I said, especially going to be in nursing, because you get to see what nurses do on a day-to-day basis and base your choice off of that if you want to continue going for nursing or if you don't. You can fall out of love for nursing, or you can fall in even more in love with becoming a nurse. So that's one. Two is you could also be like a security guard. A lot of hospitals always hire security guards, and they're needed 24/7, especially for code silver. Is it silver or brown? I think it's called silver. But anyway, altercation. No matter what, and it's not even, a lot of times it's not even like serious altercation, just like patients not wanting to go back to bed. Sometimes you get some family members that get riled up. They get mad at the nurses or the doctors, and it happens, man. You're dealing with emotional human beings because they have loved ones, or they're in pain, or they're mourning. So it's something to consider when you go in the medical field. So I think security guard is actually kind of cool because you get to see a little bit of everything, not just like a CNA and just the nursing part, but you get to see all around the hospital, man, because you get to make a better choice, especially when you're in the beginning, man. You're just doing prerequisites, man. You're a security guard. You walking outside the hospital, you walk into different departments, you can see what the RNs do, what radiology does, what PTA does, what laboratory does, and you can even see what other positions out there. There's not, just because you're in a medical field don't mean that you have to deal with patients on a daily basis. Yes, everything's patient conscience, but that don't mean you're gonna have to sit there and do patients. There's office jobs. There's a lot of stuff you can do, man. Medical scribes, what's it called, like coding. I think it's called medical coding. So that there's so many positions you can do in a hospital setting. So security is pretty cool, and like I said, they're needed 24/7. So you can, as bad as they're needed, man, you can go to school, and then whatever days you're off, what I'm saying, or if you like, okay, I got school from 9 in the morning to 3 o'clock. So that means you got from 3 to at least 11 o'clock to work, or 3 to 10, and most security jobs, like I said, aren't too crazy. So you can probably study at work. You know what I'm saying? You can take your little flashcards, take your book, you take a little 15-minute break, and you can probably study at work. CNA, there's no way you can study at work. It's just too hard, too much going on. So another one will be an ER receptionist. So ER receptionists are needed in every hospital. They're needed 24/7 because there's always patients going to the hospital. Always. It's never gonna stop. And some are legit emergencies, and then some are what they call your frequent flyers, and they just kind of go for anything, and it's gonna happen, man. You have people out there that get, they have high anxiety, or they go for any little thing, but ER receptionists are always gonna be needed at all kind of hours, so that's why it's kind of cool to do that too. You don't get to see all of the hospital, but at least you get to see what kind of medical conditions you have to deal with on a daily basis when they come in, and you can base yourself off that. Be like, do I want to continue in the medical field? It might, like I said, you might fall in love with it, or you might run away from it. You just never know. So ER receptionist, I think it's pretty cool to kind of get your feet wet in the medical field. I forgot what number that is. I think that's number 3. So number 4 will be a medical scribe. So medical scribe is kind of cool because I think this is something new that they came out with probably like a few years ago, probably like 5 years ago, that I'm guessing. So what a medical scribe does is that they follow an ER doctor around, and they take the ER doctor's notes. So basically, if it gets too crazy, too busy, the ER doctor goes into a patient's room in the ER. Here comes a medical scribe. So whatever the doctor is talking to the patient about, whatever it is, doesn't matter why you're here today, blah, blah, the medical scribe does all the notes. So this is pretty cool if you want to be a nurse, or if you're going to be like a PA, or if you want to go to even medical school, man, because you're literally one-on-one with the doctor. You know what I mean? And they're telling you what they do on a daily basis, and you pick their brain and you learn. And then again, they're needed 24/7. So scribes are needed overnight, weekends, 12-hour shifts, 13-hour shifts, whatever is needed, they're there. So again, if you go to school, whatever amount of time, you can always go to work after school. You know, I mean, you gotta grind. You know, when you're in school, man, there's no like, oh, I don't got time for this. Oh, I can't go out with my boys. Or I don't got time to work out. It don't matter. If you have that 2-year commitment, you have to be committed for 2 years, and know that you're gonna have your downtime, but 99% of the time you're gonna be in those books, in school, or at work. You know, and I was lucky when I went to school, I didn't have kids. So for all your parents out there, for your moms, your dads, single, whether you're married, trust me, I understand. It's hard. That's why I'm giving you these options, because these options you can still get 40 hours a week and still go to school. Is it gonna be easy? No. Is it possible? Yes. You definitely can make it happen. And if you're gonna be in this last one is number 5. If you're gonna be in the medical field, well, not medical field, you're gonna be in the radiology field, well, even medical. Let's just put it medical, because they do everything. A medical transporter. Medical transporters see everything, just kind of like a security guard, but you're actually in the action. You're actually seeing and transporting these patients to where they gotta go. You know, so if you're a CT transporter for the day, or an X-ray transporter, or if somebody's getting discharged, you get to go up there. Somebody's really, really sick, you got to bring them down. You get to see the whole package of what you're getting yourself into, you know, and you get to see it, you know, because you got to go to ICU and be like, oh, ICU needs they need a chest PE protocol on a patient. Then you're like, okay, well, this patient's really sick, they're intubated, blah blah. So they're gonna see it. They're gonna see the team work. You're gonna have to call. A nurse has to go down with you, RN. You're gonna have to call respiratory therapist has to go down there. Then you have to have possibly 2 RNs, and then you as a transporter to transport the patient down there. You know, and transporters are needed 24/7. But to be honest with you, I don't know if transporters work overnight. I don't think that they work overnight. I've never seen a transporter work overnight, but I know that they do work at least till like midnight. But after midnight, they don't work. But weekends, dude, they need a lot of help in transporting. And they have people in high school. As long as you're 18 and say some people are like me, I turned 18 when I was in high school. My birthday's in November. So in November, I was 18. So basically my whole school year, I was 18. So as long as you're 18, you can apply for a transporter position and see if the medical field is what you want to do. So I know this video is a little long, but I just like to give you like real facts. I know there's a lot of videos out there, a lot of like channels that show you like X-ray, radiology, whatever. But a lot of people don't really show you and give you the inside depth of what you really deal on an everyday basis, and what options you got. So I hope this helped you guys. As always, thank you for watching, and to the next one.